Okay, so I'm going to be performing continuous bladder irrigation and two-way intermittent bladder irrigation. So the first thing I'm going to do is I'm going to follow my evidence-based checklist. I'm going to follow agency policy and procedure for identifying my patient. I am going to follow standard precautions, so safety, hand hygiene, privacy, and good body mechanics. Okay, so the first thing I'm going to do is my continuous bladder irrigation. So here I have my IV pole set up with my fluid that would be warm to room temperature, normal saline. And then I have my, if not already present, I would have inserted a triple lumen catheter. I'm using my catheter from my kit, so I have that inserted here. You would never disconnect your drainage tubing from the catheter. I would prepare my irrigation fluid and Y irrigation tubing. So I would close the clamp on the connective tubing. So I'm going to pretend I have a clamp here and close it. And then I'm going to spike the tubing at the appropriate portal on the irrigation solution container using aseptic technique. So I would swab here. Well, this would have a cap, so I would just pull the cap and then spike. Okay, so then it's spiked. I would hang the irrigation solution on my IV pole. I would then remove the protective cap from the distal end of the connective tubing and hold over a sink or a trash can, and open the roller clamp slowly, allowing the solution to completely fill the tubing. And so then once it does that, I would recap the tubing. Then I would put on my gloves, which I've already got on. I would drape my patient so that only the connective tubing is showing. Okay. And so now I would place an absorbent barrier under the irrigation port of the three-way catheter. So I've got that there. And then before beginning the flow of irrigation solution, I'm going to empty the urine from the bedside. So I would come down here. This would always be below bladder level. I would have a graduated cylinder to measure my urine in. So I would remove this. And this would be connected to a bedside, like I said. And I would swab, drain it, measure it. I would record the odor, the amount, color, and then I would rehang this on non-removable part of the bed. So right there, below the bladder. Got my catheter all messed up here. Okay. So then I would pinch or clamp the tubing to prevent leakage of the urine. Okay. All right. And then I would remove the plug if present from the irrigation port. I'm going to use this as my irrigation port. I would cleanse the catheter port with an antiseptic solution. Okay. Then I would connect the end of the irrigation tube to the side point of the catheter, open the roller clamp on the tubing, and regulate the flow of irrigation solution to meet the ordered amount. The goal for this is for patients who have had a transurethral resection of prostate and to keep the urine light pink to clear. I would monitor the flow rate for 1 to 2 minutes, and then I would remove gloves, wash hands, and cover the patient and ensure that they're comfortable. Okay, so then I'm going to move on to my two-way intermittent. So I'm going to follow the first 2 steps of using sterile irrigation fluid. So I've got that here. This is my normal saline, I'm going to pretend. And then my sterile container. So I would put on clean procedure gloves, empty any urine again from the drainage bag using aseptic technique. So being sure to cleanse the bottom of that, measure it, record the amount. And then I would place a waterproof drape beneath the exposed pore, open the sterile solution supplies. So the first thing I'm going to do is I'm going to pour my sterile solution into my cup, usually about 100, 200 milliliters. Okay. And then I would scrub the specimen removal port on my catheter. I would then clamp the drainage tubing distal to the specimen, so, just like so. Okay. Then I would draw the irrigation solution into the syringe using, it would be 30 to 40 milliliters for bladder irrigation, and usually 100 to 200 milliliters is prescribed. So the first thing I'm going to do is I'm going to inject the solution holding the specimen port slightly above the level of the bladder. So we'll pretend this is the bladder here. And I would inject. Okay. And then I would inject the solution holding the specimen port slightly above the level of the bladder. If resistance is met, I would ask my patient to turn slightly and attempt a second time. If resistance continues, I'd stop the procedure and notify the physician. When the irrigant has been injected, I would withdraw the needle access device and then refill the syringe, and I would repeat this until prescribed amount is installed. I would unclamp the drainage tubing and allow the irrigant and the urine to flow into bedside drainage bag by gravity. If the solution is to remain in the bladder for a certain amount of time, prescribed time, I would leave the tubing clamped for that period of time. And then I would repeat this process until the prescribed amount has been instilled, or until the urine is clear. This is to remove any clots, mucus, and then I would, like I said, I would unclamp this again, provide safety and comfort measures, and then I would remove my gloves, wash hands, and provide comfort.